Hello and welcome. Thank you for joining us in this second webinar of the Geneva Sustainability Centre Leader Talks series. So my name's Maya van Bruggen and I'm the Program Lead for Learning here at the GSC. And I'm thrilled for you joining us today for several reasons. Firstly, because you clearly recognise the priority and power of integrating sustainability into your organisation. So congratulations, you've come to the right place. Secondly, because we have two excellent leaders and speakers from the International Hospital Federation community who've demonstrated success doing this, so you know it's possible. And finally, because you'll have an opportunity to ask questions at the end to focus in on what's critical for you to be able to make a difference where you are. So on that note, please feel free to put your questions in the Q&A and we'll come to them after the presentations. So I'm extremely fortunate to work in this team as the Geneva Sustainability Centre supports leaders around the world with the information, tools and skills to make the transformation towards more sustainable healthcare. So the Geneva Sustainability was established over 3 years ago as part of a commitment by the International Hospital Federation to shift towards low carbon and resilient care. So a key part of our work is helping our members integrate sustainability into all aspects of their healthcare systems. So we do this through our learning programs, through our tools, and also through our collaboration with partners on the healthcare sustainability certification. So at this point, I want to acknowledge that all our contexts around the world obviously vary. So there's no one-size-fits-all solution or approach. So what you'll hear today are two journeys and their insights, which will hopefully help you in some way on your sustainability integration journey. So for your convenience, I will also put this link to our IHF statement for sustainability into the chat a little later on. So as part of setting the scene for today, I thought I'd take a moment to share 3 key messages from my own experience. So first, sustainability is a team effort because no one has all the answers. So connecting to share and learn from each other across organisational, sector and national boundaries is a powerful way to accelerate action. So in that spirit, if you've just joined us, please feel free to add your name, organisation, role and country into the chat so you can potentially connect with others after this webinar. Second, there are many opportunities to integrate sustainability into an organisation's DNA. So if you're struggling to influence or make progress in one area, then it's okay to switch focus or effort to pursue another area where there may be support or enablers in place, which will allow you to make progress. So this list here represents the areas which my team of 2 and I worked on in my previous role as Director Sustainability Action in Australia. So these are the areas we tackled in the first 2 years of our journey, and there's still a long way to go, but we worked on the basis that if we were able to get these things in place, then sustainability would effectively become a core part of all aspects of the design and delivery of healthcare services and operations. And the third key message from me today is that sustainability cannot be deprioritised or thrown off the agenda if it's integrated into every aspect of your organisation and healthcare delivery. So on that note, it now gives me great pleasure to introduce you to Jeremy Lee from the National University Hospital Singapore. So under Jeremy's leadership, the NUH was the first hospital in the world to receive International Healthcare Sustainability Certification. As Chief Operating Officer, Jeremy has spearheaded over 250 green projects within the NUH, and he's currently heading the Green and Mobility Task Force at NUHS. I'll add more details in Jeremy's LinkedIn profile into the chat so we can get straight into hearing about how he did this. Over to you, Jeremy.
Thank you very much, Maha, for the introduction. So good afternoon, everyone. Maybe before I start, I'd like to provide some context. The healthcare sector contributes about 7% of Singapore's total carbon emission. And at the same time, Singapore is also one of the world's lowest lying nations and highly vulnerable to impacts of climate change, from rising sea levels to extreme heat and inclement weathers. So sustainability is therefore not just an environmental agenda, it is an existential imperative. So our starting point has always been green healthcare is good healthcare. So when we start to talk about sustainability in healthcare, the real challenge isn't getting started. It really is how do we make it stick. So starting is actually the very easy part. You can launch initiatives, you can form green teams, you can run campaigns, but those efforts don't really last. So the real question is, how do we make sustainability part of how we deliver healthcare every day? So let me elaborate. So in NUH, we take a whole of system end-to-end approach towards sustainability. So we lead it through from governance and leadership. We build it into our systems and operations, and we live it in our culture and our day-to-day. So let me take some time to elaborate some of these factors. So in leading it, our board has oversight of all our green agenda initiatives, and it is embedded into our balanced scorecard. And our groups at the institution level or at the cluster level, our group CEO actually chairs the Green Steering Committee. And under him, there are multiple task forces that helps to look after various domains of sustainability. And at the institution level, we have the institution leadership looking after green committees that is driving both the top-down as well as the bottom-up initiatives from the cluster as well as from the institution. And very importantly, sustainability is embedded into every department's work plan. So in building it into our systems, one of our key things that we adopted was that we raise, train, and sustain an in-house carbon accounting team. And that's actually very useful because it actually helps us identify where our hotspots are. But more importantly, we are able to tackle them from an operations standpoint rather than from an accounting standpoint. And we also set very clear and ambitious target for our teams because it shows our urgency and determination and also encourages our staff to aim higher. So we actually set a target to achieve net zero by 2045, which is 5 years ahead of the government's goal. And at the heart of this journey is really about building a culture, enduring culture that is coherent and is deeply rooted into who we are as healthcare professionals. So culture won't change overnight. It only changes when people believe in it. There's leadership emphasis and it's embedded into our day-to-day. So for example, in terms of value-based care, it's no longer just quality and cost. It is now quality, cost, and carbon. And for procurement, we also have embedded environmental impact into all our procurement decisions. So we now mandate that at least 10% of the criteria must be now set aside for environmental considerations. So but even with all these that are in place, the question remains, how do we make it stick? Because sustainability is not just about having a strategy. It's about whether it becomes part of how people think, how they act. So when we say live it at NUH, we basically focus on three things: purpose, integration, and coherence. So first, about purpose. So at the heart of healthcare is the simple idea that we are here to protect health and to reduce harm. And if climate change is affecting health, then responding to it becomes our duty of care because the principles that guide us is still the same. First, do no harm. But today, doing no harm goes beyond what happens at the bedside. It also means thinking about the environment that shapes health. And this is actually shared work. It is clinicians, operations, procurement, partners, everyone in the system. And we don't position sustainability as an environmental agenda. We position it as our mission. So once people see that connection, it changes how they relate to the work. And we anchor that right from the beginning. It is introduced from day one through our corporate orientation programs. When someone joins NUH, sustainability is already part of how we talk about care. The second piece is about integration because good intentions don't scale, but systems do. So if sustainability sits outside operation, it will always stay at the margins. And so we focus on embedding it into how we run the organization, and we incorporate it into our operations excellence framework and policies. We use outcome-driven metrics to track real impact, and we recognize and celebrate success because that reinforces behavior, and over time, it becomes routine. And this is when sustainability stops being extra work, it becomes part of how we work. And the third and most important piece is coherence. Because what makes sustainability stick is habit. And we focus on making sustainability relatable, for example, the number of flights, trips, kilometers saved, trees saved. And we also want to make it actionable. For example, giving departments their energy consumption, their paper usage, so that they can act upon it. We also do this by having leaders talk about it consistently, enabling teams on the ground, reinforcing it through recognition and visibility. Because behaviors are repeated. Once they are repeated often enough, they become second nature. And that's really our goal, to make sustainability not an afterthought, but in how we deliver care. So from what I've shared, these are not just wow ideas and concepts. And across NUH, we have implemented over 300 sustainability projects in the last 3 years, big and small. And these are not just environmental initiatives, they are clinical, operational, and patient-centered improvements. So allow me to share some of these initiatives. So at the clinical front, remember when I said green healthcare is good healthcare, and appropriate value-based care is exactly that. And we look at 5 domains of appropriate care, from care consolidation, and life care, medication, bedside testing, and laboratory tests. So really reducing unnecessary procedures, tests, polypharmacies, save time and cost to patients, but critically, it also reduces our carbon footprint. In the outpatient setting, we have started to push actively for teleconsultation as the default. So we actively move patients to teleconsultation, so that helps save their trip to the hospital, and that actually helps to save carbon as well. And we also starting to make digital as a default for our operations as well, switching to paperless registration, billing, printing of medical certification and medical reports, or moving them to a digital mode to save paper. In the area of upcycling, we have also started to refurbish MRIs and CT scanners. So rather than just buying new, we have started to refurbish them. And that not just helps us to save carbon, money, but very importantly, it also helps us to reduce the amount of downtime when we are doing all these replacements. And in our pharmacy, we have stopped giving out plastic bags for our patients, and we have encouraged our patients to use reusable bags when they collect their medication in our pharmacy. In the inpatient settings, what we have done is that we have encouraged patients to bring their own items, like pajamas, and even their own food, because we realize that a lot of times they bring their own food and they throw away the hospital food. So with this initiative, it actually helps us to then ask patients to opt out of the hospital food if they're not bringing, and that helps to save resources as well as, more importantly, food waste. And at all our wards, we have started to segregate our waste at point of care. So our nurses now segregate their waste as they are delivering care. So there are little bins that are mounted on the nursing trolleys, the patient trolleys, so that our nurses can segregate their waste when they are doing their rounds. And in the operating theatres, other than switching to switching desk urine and nitrous oxide to greener alternatives, we have also started to reduce the air exchange of our operating theatres after hours when they're not in use. And this initiative actually helps us to save more than 40% of energy consumption for each OTs. And for all surgeons, we have been working actively with our surgeons to reduce the amount of surgical sets for surgery, and that helps us to save carbon, cost, and very importantly, water, which is a huge component of sterilization. And The last example I would like to share is about trying to introduce innovation into how we run our facilities management. So we have piloted in two of our clinic floors what we call the integrated data platform. And it is actually the first AI-enabled smart clinic in Singapore, whereby the system is able to predict or adjust or moderate the temperature, the lighting conditions based on occupancy at a point in time, as well as the environmental conditions. And really beyond energy savings, it also helps us to be more predictive in terms of how we maintain our system, because the system is able to then predict what are the elements that potentially can have faults, and then it triggers our engineers to then replace them proactively. So really moving from being reactive to predictive and then prescriptive as well in terms of how we manage our facilities. So finally, in closing, so when we talk about sustainability in healthcare, it is easy to think about it as another initiative, but it is really not that. It's about how we deliver care now and into the future. So at NUH, we keep it simple through governance, we build it into our systems, and we live it through our culture. Because in the end, sustainability only works when it becomes part of everyday care for our patients, for our people, and for the future we are all responsible for. So thank you for your attention.
Thank you so much, Jeremy. That's outstanding. A lot of insight in that presentation. And now what I'd like to do is welcome to the forum Kyle Tafuri. So it gives me great pleasure to introduce you to Kyle Tafuri. He's the Vice President Sustainability at Hackensack Meridian Health in the US. So Kyle led the creation of corporate sustainability at Hackensack Meridian Health in areas including on-site renewables, green buildings, sustainable food, waste reduction purchasing, and safer chemicals. So the Hackensack University Medical Centre has been recognised by Practice Green Health as a top 25 green hospitals 10 years in a row. So again, I'll add more details about Kyle into the chat so we can get on with hearing how he did this. Over to you, Kyle.
So, Hackensack Meridian Health, just a little bit, about us. We're in one state in the U.S., but we have 18 hospitals, over 500 patient care locations, and over 40,000 team members. So how we like to frame it is, and we have our own school of medicine, which has really helped drive a lot of our efforts. But how we frame it is, we do a lot of good, but with that good, we obviously have a pretty big footprint. So next slide. So one of the things that, when we talk about integrating sustainability, and Jeremy put it well, just having green teams and whatnot, it's tough to sustain that. So what we've done is we've really tried to implement sustainability into every aspect of what we do. And we were the first hospital and first health system in the United States to get the Joint Commission sustainability certification, which was a big deal for us. It's a voluntary certification, but we were committed to doing it. And we actually then hosted the Joint Commission leadership team along with, and this is some of our presidents, our CEO, and Dr. Jonathan Perlin. We hosted them at our site to talk further about sustainability and just overall, how do we make sustainability not just be a side thing, but integrate it into all the aspects of the operations? Next slide. So, it starts with ensuring that it's a strategic priority. You don't need to look at all of these priorities on this page, but if you notice on the 7th one, sustainability is one of our strategic priorities. These are approved by our board of governors, and it's something that I believe it's really more symbolic than everything to team members to show them that along with delivering superior patient care, all this, like, sustainability is a part of what we're trying to do. Next slide. So one of the big pieces here is we tie sustainability to executive compensation. So we do it actually on multiple levels. So this is a scenario of be careful what you wish for, because when we advocated to have this included, I did not really anticipate the amount of work that comes with consistently updating the metrics and explaining to the board and to the executives, where we are at, and if we are not on track, they remind me of the pressure to ensure we get there. But this was something that we did. This was for our CEO and a couple other of our top executives, where over a 3-year period we had to reduce Scope 1 and Scope 2 emissions 15%. By our baseline. I can confidently say that we did achieve this goal. Hence, I am still here presenting to all of you today. You can go to the next slide. But so, we have at that level, and actually then we have each hospital president had their own sustainability goal that we tied in, so that it wasn't just at the corporate system level, but we really wanted to have it everywhere. But this is a big example of, in our ORs, or the operating theaters, we came up with, we had this charter on how do we cut waste and costs in the OR. And I met with the leadership team to say, hey, looking at like the OR kits and all the packs and all the unnecessary supplies being wasted, I said it would be great for us to talk about the sustainability work with your business analysis charter. Because, in some places you would have this charter, but then you'd have like a separate little green team. But we said, no, we want this to be a part of, all of the department chairs, whether it's orthopedics, neuro, like all the areas are a part of this. And throughout this, we have multiple areas, whether it's mentioning anesthetic gas, reducing supply costs, which we associate with really the waste piece. And it worked. I can say that we eliminated desflurane, and that was a direct result of really integrating it into these main committees within our system. So you can go to the next slide. And, other ways in terms of how we integrate it, this is a partnership. And we said, we have all, we're a large health system. So we're a $10 billion not-for-profit health system. So we have a lot of purchasing spend, a lot of purchasing power. So when we partner, and we're looking to expand this, but we started with areas. So our waste, the organization that handles all of our waste streams, all medical waste, garbage, recycling, we set sustainability waste targets with them. Our EVS directors, the housekeeping directors, as part of their annual evaluation, had a sustainability goal with those waste percentages, but so that we ensured that everybody had their a piece of the game going. We find if we did not hit our sustainability goals, our waste partner would have to pay us back 1% of the annual contract cost. So this is an area where, listen, we say our leaders are financially being held accountable, so we're going to hold you accountable. So they actually gave us somebody that's on site, traveling to all of our hospitals, working with our leaders to help ensure that we meet those goals. And I can say that we've achieved over 30% recycling at all of our hospitals and around 4% regulated medical waste, which is, a very impressive piece, considering if you saw when we started, we were at about 10% recycling, if we even recycled at a campus. And then our medical waste was a lot. And I'll leave it at that. So then we did the same thing with chemicals. We outsource our cleaning services to a third party. They really handle the management of our EVS team. If they did not achieve 90% above on third-party certified cleaning products, same thing again. There were financial penalties. But I would say that probably the best area is really our food program. And these numbers now are even higher, but we have multiple, as you can see, there's antibiotic-free meat. That's kind of what we started at, but with the bigger purpose being less meat, better meat, kind of is the frame that we use. But reducing the amount of meat, obviously, for most folks here, they know in the U.S. they love to eat a lot of meat here. So, we said, all right, we're going to reduce the portions of the meat sizes and we're going to have it be more plant forward. And something that I don't have here is that we joined the Cool Food Pledge by the World Resource Institute, and we we're the top health system in terms of we reduce emissions per plate by 40, 50, or 60% since we started. But we tie this to the goals because we outsource food as well. And the management company, we give them those goals. Our leaders take the goals, and it's just a way, it's not meant to just penalize. I don't want them to be paying us. Like, we want to meet our goals. But, I think we've seen more resources being put towards it from them that may not have been, put forward if we did not have those stipulations. So, it's by including this, it's one of the main KPIs, the key performance indicators. So every business review we have with all of these partners, this is one of the things that's talked about. To wrap it up, I mean, it's a journey, and for us, it's really being opportunistic. And I think, the one thing universally that I've seen from all hospitals that I visited around the world, uh, a lot of times people are doing more than they think they are. And a lot of times it's just not being documented. Like, they're not telling the story. So we make sure, actually right now we're doing an innovation committee. So we have a whole innovation department that, sometimes they're working on helping develop drugs with like all types of research and innovation. Well, there's a sustainability component of that. We're having a competition across all the areas. Yesterday, I was in our labs, talking to all the lab leadership and their teams. So, we integrate it through, and even if folks don't have sustainability people, sustainability is a tenth of my job. And in every area that I work, there's always ways to identify opportunities in aligning this work. And I think, that's really been our journey. And there's a lot more. And especially I enjoy being a part of this. So thank you, Maya, for this, because hearing from others, we shamelessly steal others' great ideas and we implement them here.
Excellent.
So
that's perfect. That's exactly what we want to be doing. Shamelessly stealing from each other for the betterment. So thank you so much, Kyle and Jeremy. What I'd like to do now is go to any questions that our participants may have. And just while we wait for those to come in, I need to acknowledge we have a number of people online who are actually quite advanced in their integration of sustainability journeys across the world, including the Philippines, including Taiwan, including Indonesia. So shout out, thank you so much for all of you who have dialed in. And also, Andy, good to see you online from Rush, and Ian, terrific. So if there are no questions immediately forthcoming, I'm going to add one into the fray. So in your opinion, Sorry, let me find that. In your opinion, what factors enabled your organizations to successfully integrate? So, for example, Kyle, you mentioned it's important to be opportunistic. And for example, I know in Singapore there are some excellent enabling factors in terms of the national policies and green plan. So maybe if I start, Jeremy, with you, can you sort of talk about the top one or two enabling factors that allowed you to integrate?
I think, can you hear me now?
Yes,
Hello.
absolutely.
Okay.
Go right ahead.
Yeah, I think first off, I think the most important thing is strong leadership direction. So like I mentioned earlier that our board has oversight, and then at the cluster level, our group CEO is actually chairing the Green Plan Steering Committee and providing directions. And at the institution level, like myself, I chair the NUH Green Plan Committee as well. So there is a lot of leadership emphasis from the top, from the bottom, and that actually sets a direction for the hospital to take this seriously and to have traction in terms of sustainability. And then I think the second important part is that it is not a separate track. It is part of one of our core priorities, and we frame it as part of patient care as opposed to an environmental agenda. So that helps to connect with the healthcare workers, the professionals, and they see some relevance in the sustainability journey and initiatives, and then adoption became more natural. And then of course, third, like you mentioned, there's also national sustainability targets that push us to decarbonize, and that sets both the urgency and legitimacy in terms of us pushing for this sustainability goal. And then I think finally, the most important part about this journey is about ground-up engagement. So how we get our staff involved and allowing them to see tangible wins, like the recycling programs that we have done, or reducing single-use items. And that actually helps to build momentum. I think once people can see momentum and they can see recognition and the whole thing moving, it actually shift their mindset over time. So I thought these are the few things that are very important. Yeah.
That's excellent, Jeremy. Thank you. And that relates back to what Kyle was saying about the importance of telling the story. Now, I do note there are some questions here in the chat. And so maybe what I'll do, one of them is for you specifically, Kyle. How hard was it to get the senior execs to agree to link bonus payments to sustainability KPIs?
I think
Tell
they
us that
got,
story.
yeah, I think some of them might have gotten tired from me constantly showing up at their office telling them that we should be doing it. So they probably wanted to just keep me out. But, I think, listen, energy, scope 1 and scope 2 emissions. I mean, energy costs here in the US are skyrocketing because of the AI data centers, all that stuff. So we're seeing, we're going from spending, 20-30 million dollars a year on energy to 40-50 million and up on energy. And, I framed it as I think people don't just want to see dollar amounts. People get tired of saying, oh, it's about saving money. So we were able to frame it in a different way. It's like, all right, it's about using less energy. At the end of the day, that goal was primarily around energy reduction. And, we had some major projects in the works. We're installing 25 megawatts of on-site solar. We've done 140. We're actually signed $45 million worth of new energy efficiency work. So, any of these goals that you set, you want to know that you can achieve them. And I think we had that momentum going. And so what I said before, it's all about that story. And we had a very good story to tell about that. Setting it for the 15% reduction in 3 years was bold, but we figured it out. And, I think, like I said, and like Jeremy said, it's all about, leadership. Our CEO, and we did this, during a time where there was a lot of narrative, going on within the US that maybe wasn't as supportive of some of the work, but we said, hey, this is what's right for our patients, our community, our bottom line, and we're doing it. And we did.
Thank you. That's fantastic. Okay, I have a question here. Any challenges from the staff, especially physicians? So I'll go back to you, Jeremy, if you had any challenges in that area.
Okay, I wouldn't say that it's a challenge. But actually, what we have advocated is, like I said in the beginning, right? It is part of our mission. It's green healthcare is good healthcare. So in fact, we have embedded sustainability as part of promotion criteria for our clinicians. So for example, every clinician that needs to be promoted, they need to do a project. So previously they did many clinical projects, but today we say that green projects can also be part of your promotion project that you can embark on. So we actually make it as part of their promotion criteria, and that actually further reinforces the need that sustainability is part of good care. So I think I would say that we are fortunate that our clinicians are through all these efforts that we have put in over time, we get lesser and lesser pushback. But like you said, sometimes it's a little bit not so easy to balance the equation when it involves patient safety, or it involves maybe some clinical protocols. But we are very, very clear. So long as the whatever that we are doing doesn't compromise care, it is good care. So
Absolutely.
anything that compromises care is bad care. So we will not push. We'll be not so foolhardy to push for initiatives that doesn't help the patient. So I think the balance is we have a balance point, and that helps us to push our initiative through more easily or more regularly.
And that's a really powerful framing opportunity. And there are some more questions here, but I will go to you, Cole, just briefly in terms of how you engaged with clinicians, just briefly.
Sure. So, I think, and this is something that we've really kicked into high gear as of late. And actually, I presented at the last World Hospital Congress in Geneva some of that work we were doing with clinicians. But the most sustainable healthcare is the healthcare we don't have to deliver, right?
Absolutely.
And what we said here is, our incentive models here, prevention, it's a lot of it's really based on sick care. So we said, how do we tie quality into our sustainability work? So we've started to showcase saying, looking at by having great quality results, and Jeremy said it well before, again, it's about great patient care. At the end of the day, people come to hospitals to be taken care of, right? You were sick, you want to not be sick anymore, you want to be fixed, and you want to get out as quick as you can. So we started looking more holistically and saying, okay, like we're doing this innovative robotic procedure. Well, some folks were saying, well, robotics use a little bit more waste, all of this and whatnot, but we have reduced length of stay, reduced readmissions, reduced blood transfusions, above the bed, leading the national average. So in our world, that's more sustainable because those people are getting, out and having better outcomes. So we do that, but a lot of it's just, let a challenge. We have too many doctors. We have too many ideas here, right? And it's good. That's a good problem to have. But we just get out there, and we get out there in every setting, and we tell the story, but we change the story depending on the audience. So our oncologists want to talk more about plant-forward diets and safer chemicals. Pulmonologists want to talk more about air quality, EVs. So it's changing it, but then finding and telling the quick wins of all the little things that we're doing, because it adds up when you're spending a couple $1 billion in supply chain, like it's going to add up. So that's how we've really engaged it, and they're vocal too. They let me know. So
Excellent. Yeah, anyone that's been in the healthcare sector for more than 5 minutes knows they have their piece, and that's critical.
Yep.
So time is marching on. There are a number of questions, so apologies if we don't get to all of them. Please do reach out afterwards and follow up because we can take it offline. I'm going to put you both on the spot now because there's one question here which says, for healthcare institutions that want to start this journey, where is the highest leverage first move? So like 30 seconds or less, just give me your top most powerful one. Jeremy, do you want to, or
I can
Kyle, you
I
go.
can mention
You look ready.
I would say the two quick ones. First, food is medicine, obviously, tying to that food piece. But second is nobody's going to argue with the upstream waste, preventing waste at the source. Just walking through the theaters, as everyone calls them, the theaters, and observing cases and just seeing how much stuff is opened and thrown away. And a lot of the times what we found was you ask the staff, like, why are you doing that? And it's like, well, we've been doing it for 10 years. And, that doctor needed that item one time. And it's like, okay, like it's just having those conversations of upstream waste, you save money, reduce waste, everyone's
Excellent.
happy.
Perfect. Okay, Jeremy, 30 seconds or less. What have you got for us?
I think the easiest area to integrate is really to move to more operational and the more visible ones like energy, waste, and facilities, because these are areas where the impact is quite tangible and you already have established processes. So it's easier to optimize or to introduce improvements. And we really saw some also earlier traction in areas linked to circularity, like reducing single-use items or improving segregation and recycling. And these are relatively intuitive to the teams because they can show very quick and visible results, like what Carl mentioned as well. But I think the more challenging side is it tends to be an area where it is more clinically sensitive, like what we talked about earlier on, and or those areas where we have less control, like for example, our supply chains. So these are the areas that we're continuously trying to engage with our suppliers to see how we can then all decarbonize together in partnership.
Excellent. Thank you both very much. And I just wanted to share with you very briefly that if you want to know more about these conversations and learn from others around the world, super excited to share with you that there is a whole sustainability track at the World Hospital Congress. It's in Seoul this year. Over 1,700 participants from 80 countries are expected. The program is now available. Early bird rates are available until the 24th of July. We so hope you can join us. And also, if you want to get in touch, I just want to say thank you again to Jeremy and Kyle for your time and insights. I invite you to connect with us at the Geneva Sustainability Centre. Happy to have a conversation anytime to hear about what your context is, what your needs are. And keep an eye out on our socials for our next webinar in the GSC Leader Talks series in September. Thank you so much for your time and all the best for what you do integrating sustainability into your organisation. Maybe we'll be able to profile your leadership story here in the future. Thanks again and see you soon.